majina naitwa Sara Nafula Simiyu. Niko na mume mmoja. Niko na watoto, vijana watatu, kijana mmoja. Nafanya kazi ya ukulima. Huwa ninapanda mboga. Nimepanda mboga kwa muda wa miaka 9. Tena mimi ni mfugaji wa kuku.
Article 43 of the Constitution of Kenya 2010 guarantees every person the highest attainable standard of health, which includes the right to healthcare services, including reproductive health care. In addition, the Constitution introduced devolution in a bid to bring service delivery closer to the citizens while ensuring that they participate in the prioritization of their needs. Health became a fully devolved function, leaving on policy matters at the national level. From the onset of devolution, many county governments have faced numerous challenges in the delivery of healthcare services to their citizens, and Busia County is not an exception. However, in Igula, accessible healthcare had been a pipe dream until very recently. The people of Igula had watched a stalled health facility in their neighborhood for years, while they still traveled for kilometers to get services.
We had almost 40 memorandums from entire cross-cutting from this down village ya kule chini Butunyi. Those memorandums that 40 memorandums mpaka tukatuma kwa office kupeleka kwa ofisi ya ward admin, ward ya MCA, mpaka they started calling each other. Initially it was the government was not doing anything. Vile tuko na that push from the community. But now after these meetings, sensitizing community to understand their role, to know what's our those memorandums and those delegations have made the county government and the county government now to at least try to start acting, to try to ensuring kwamba if we don't do anything, these people from Igula community will still come for us.
We were not very happy with the Department of Health, the way they were handling the department, because there were a lot of rollovers, stalled projects in the department, and even the way their system of the projects in terms of implementation was too slow.
Despite many family obligations, Sarah still finds time to participate in issues affecting her well-being.
Kupitia kwa sisi, hizo memorandums ambazo tumeandika zikaenda kwa ward admin, zikatoka huko, zikaenda mpaka kwa chief officer Busia. Hiyo imetupatia morale, ndio sababu hiyo hospitali ikaweza kufunguliwa.
Before Igula Dispensary became operational, residents had to travel long distances to get medical services in the nearest health facility.
And the community are very responsive to that, and they are very appreciative for bringing to them the facility near to them, as most of them claim they were really using a lot of transport to go to Hunyangu, Burinda. Those ones from around, they can just march here anytime, and they are treated the way it is required. I always tell them we have challenges of drugs, but they say, sister, we shall understand, and I know we shall pick up. I tell them, I usually work with the community health volunteers, whom I tell them to go and mobilize in the community, and tell them actually Igula has opened. The mothers, the children should be brought here for the services that they require. When I give them the program, they go tell them, and most of them come here for the services.
Although the dispensary has greatly eased the burden of seeking medical services far off, there are gaps that require urgent action. According to the National Council for Population and Development, in a country where maternal mortality is over 400 deaths per 100,000 live births, lack of a maternity unit here brings to fore the need to prioritize construction of one.
Ningependa kama county government itusaidie tuwe na maternity wing. Venye hiyo hospitali ilikuwa haijafunguliwa, hakika wamama wengi walikuwa wanajifungua nyumbani. Lakini kwa saa hii kupitia katika mafunzo ambayo wanapata Igula Dispensary inawasaidia ili wajipatie muda wa kufika hospitalini mapema.
So financing for healthcare services is grossly inadequate, and that's really a challenge for us. If we wanted to conduct a delivery at Igula Dispensary, we don't have a maternity ready there. So again, we don't have space for deliveries, and deliveries are happening day in, day out. We don't have a staff house at Igula. So the health workers at Igula, the nurses, and the community health assistants probably commute from elsewhere. And you know that is affecting quality service delivery. They have to take care of the rains. Sometimes they are delayed by public transport. They risk border traveling, and that's really compromising services.
Even with the completion and operationalization of Igula Dispensary, going beyond just capital projects and allocating resources for operations and maintenance remains a major challenge in Busia County. This has affected allocation of resources towards equipment and running costs.
What we are offering is equitably provided throughout the county of Busia. However, due to one, the funding challenges, you find sometimes we are not able to reach out to everybody with the services they have. Funding is one of the causes of inequity in our area. And then we also look at the area of human resource. Human resource is a big challenge that we are not able to equitably distribute them to all the people. This has disadvantaged some areas where you find like some health centers have very few human resource providers. We also have issues of commodities, not forgetting infrastructure issues. We still have a challenge that we are not able to have all the facilities having the same equipment.
Through partnership between the International Budget Partnership IBP and Community Empowerment Development Center CEDC, the budget champions have played an important role in ensuring that needs of the community members are addressed. The budget champions are members of the community who are trained to understand the budget-making process and to sensitize others on the need to participate in the process.
The partnership between IBP and CDC, imesaidia watu understand, kumbe nothing is going to be implemented without the implication of the budget. So as a budget champion, CDC trained us, it gave us information. We are trained on budget issues, budget stages, budget how to follow up. We train communities on how to follow, how to participate in budget making processes, and how to also monitor the implementation of the budgets. Issues affecting Igula. Because of the information concerning number of budgets that I was giving these community members that helped them as an advocacy tool. Kujua, this is the time. You need to implement it because this already we tuliweka kwa bajeti and we are not seeing anything being done.
Wametusaidia sana kwa sababu hatukujua kwamba sisi kama wananchi wa Igula hatukujua kwamba kuna mambo fulani inafaa tufuatilie, lakini kupitia hiyo imetusaidia na tumefuatilia na tumeona matunda.
Focus is now turning to the entire county with hope that more can be done to complete stalled projects across all the sub-counties.
The journey that we've started with, we started with the IPP, and going forward, I believe we still have a long way to go. Building, and again, we are looking forward to cover the entire county.
For Sarah, her role as a community volunteer and a change agent will inspire more women to participate in the development of their community, given the gains witnessed in Igula.